Hello and welcome once again to Anesthesia Tools. Today we will discuss an equipment, a life-saving procedure. No points in identifying this equipment because we are all supposed to know this equipment in and out, which is present in all the crash cards. This is manual external defibrillator. Other similar equipments are automated external defibrillators, that is AEDs, internal cardioverter defibrillators, ICDs, and wearable cardioverter defibrillators, WCDs. Coming back to this equipment has three major parts. You can see ECG leads. This is the main unit with the control buttons and the monitor, and either defibrillator pads or paddles, as you can see, which is attached to the machine. Anytime you need to use this equipment, it is always advisable to know your machine before using it, because each manufacturer might have given a different settings, but generally most of the things are common, and it is very important to know the basic functions of external defibrillator. Looking closely, here you can see an on off button. This is from off position, I am changing to on. So this is for monitoring purpose. You can attach the ECG leads and monitor the ECG in this screen. If you are using this machine for defibrillation or cardioversion, we need to select the electrical energy to be discharged, which we can do by dialing this button. For cardiac arrest, we can dial up to the maximum available in the machine. In this machine, it is shown to be 200 joules, so I assume this is a biphasic defibrillator. Now coming to what is biphasic and monophasic. Monophasic defibrillators actually discharge the electrical current for defibrillation from one pad to the other in one direction only. But newer defibrillators have biphasic defibrillation. That means initially the current passes from one pad to the other, just like in monophasic, and then it changes direction and comes back to the original pad. The idea is to reduce the energy dose required so that the effectiveness will not be compromised by reducing the joules selected. Most of the newer defibrillators are biphasic. Again, coming closer to this machine, apart from the knob to switch on and off, then energy selection, you can see a sync button which is used to facilitate synchronization with the patient's electrocardiogram or cardiac cycle, which is enabled by this sync button. Important thing is to make sure that the ECG shown in this machine can only be synchronized. So even if you apply discharge button, the energy will be delivered as per the sync function of the machine. This is not applicable when you are going for a defibrillation. Again, you can see the next button, which is used to charge, the yellow button, and the third button, the step 3 button, is for shock. Shock is to deliver. Again, you need two people to operate these buttons because the person applying the paddles will be closer to the victim. So if you are all alone, don't worry, switch it on, select the joules, and then take off the pads. So we need to know how to take off the pads. Each machine may be different, but your familiarity is very vital in a difficult scenario, in a cardiac arrest scenario. So this is how you take the paddles. This is called paddles, and if you are going to use this is called pads, which you can stick onto the patient's or victim's chest. Where to apply? It is actually diagrammatically represented on the pads where to put. For example, this one you can put below the right clavicle or right infraclavicular area, and the other pad will go to the apex of the heart. This is the regular positioning of the pads if you are using pads. Again, if you come to the paddles, you can see this paddle can be applied to the apex of the heart, and the second paddle can be applied onto the right infraclavicular part. So once you have taken the paddles in your hands, you can apply jelly so that electrical contact with the body will be nicely maintained, and then apply onto the body. And now you can use this button. This again is the yellow button with number 2 written over it. Since the energy is dialed on the main unit, we can simply apply the yellow button. You can hear the machine is charging between these paddles, and now you can see the buttons for defibrillation or shock flashing. So you apply to the patient's or victim's body firmly. Make sure you are clear, all are clear, nobody is touching the victim, and then press these 2 buttons simultaneously to deliver the shock. So in a cardiac arrest scenario, if I am assigned the role of defibrillation, what I do is I'll bring the defibrillator from the crash cart, position it so that I won't interfere with the flow of activity, that is the chest compression, airway, IV access person, etc. So I'll keep it there, power it on if possible, and then for an adult victim, I'll dial 200 joules if it is a biphasic, or whichever is the maximum energy available in this defibrillator. I can dial it, and then I'll get ready for the first opportunity to defibrillate. So after the chest compression is over, I'll apply the paddles. Okay, I have already dialed the joules. Then I'll charge the machine. Okay, when charging is done, the buttons will start flashing. Then I should announce to the team, I am clear, you are clear, all clear, and then press both these buttons simultaneously to discharge. Immediately after defibrillation, next step is to resume chest compressions. If you are using AED or a manual defibrillator with pads available, the advantage is without interrupting the chest compressions, we will be able to attach the pads, okay, and including the charging of the defibrillator we can do without interrupting the CPR sequence. So the moment the ECG analysis is over and it shows a shockable rhythm, we can immediately clear the victim, do the defibrillation or shock, and resume the CPR. That will improve the efficacy and improve the chance for return of spontaneous circulation. Can you use these paddles for a pediatric victim? The answer is yes. If the child is grown enough, you can apply on the chest in the designated positions. Make sure these pads don't touch each other. For a smaller child, we need a lesser surface area that is actually provided here itself. You can remove it, and now you can find the pediatric paddle size. Okay, from defibrillator we'll go to the next use of this machine, which is cardioversion. Cardioversion is applicable when a tachyarrhythmia situation and the patient is unstable, like the patient is having hypotension, altered mental status, ongoing chest pain, signs of shock, and any unstable scenario. Then you opt for cardioversion, where patient may be conscious and responding. So the basic steps of cardioversion are 3 C's, 3 S's. One is consent. At least a verbal consent from the patient and the bystander should be taken as far as possible. Second C is cannula. You need to administer IV medications, and maybe patient might become more unstable after your intervention. So cannula is a must. Then you should bring in the crash cart. Now we go to 3 S's. First is sedation. This is a slightly painful procedure. It's an uncomfortable procedure for the patient. So you can consider a sedation with say benzodiazepine or a narcotic or a small dose of propofol or thiopentone, whichever is available depending on the clinical scenario. Second S is sync button. Again, you come to this machine, you select the energy required, say for atrial fibrillation, you select something between 100 to 120 and then press sync. Make sure that this ECG electrode should be displayed on the device, and you need to attach the ECG leads of the defibrillator. Then only you can get the ECG on the monitor. And when you get the sync button active, you can find dot marks on the QRS complexes. So whichever point you are pressing the shock button, the energy will be delivered only up to the dot mark or sync mark or at the peak of R wave in the patient's ECG. This is very important. So once you press the sync button, the last step is shock. So before that, charge the defibrillator. Make sure nobody else is touching the victim. I am clear, you are clear, all clear, and then do the cardioversion by delivering the electrical energy across the heart and then hoping to get an organized rhythm afterwards. So this is the step of cardioversion. Again, after any change in ECG rhythm, make sure you check the central pulse and make sure you are getting a perfusing new organized rhythm. So you need to be cautious, you need to be monitoring. Immediately after the procedure, check the vitals again, see that pulse is present. That's when you finish the process of cardioversion. If the patient's rhythm is not responding to a particular energy, you can repeat the procedure with a higher joules and repeat all the procedure once again. That's how you plan for synchronized cardioversion. So next time when you happen to use this machine, manual external defibrillator, try to understand the machine, use it more sensibly. Goodbye, good luck. It's me, Dr. Sanish, signing off. Thank you.